Moses is a physician assistant from UVA's Heart and Vascular Center. She's here today to talk about something called arterial or aortic dissections. Now, it's a big problem facing baby boomers, the aging baby boomers, but go ahead, run through what is an arterial dissection?
Well, a artery is the main blood vessel that brings blood from the heart out into the body.
Sure.
And they're tubes, and the walls of these tubes are made of many different layers. And what happens is there's a tear in the inner layer of the artery, and the constant pressure forces the blood through the tear into a false path between the walls. And the concern there is that blood can't get to where it needs to go. And it's following a path that we just don't like.
Okay, tell me a little bit. Who is at risk for this? I mean, we talked about aging baby boomers. Who else is at risk?
The main risk factor for an aortic dissection is high blood pressure or hypertension. And this is more common in your middle-aged to older people, more often men. There are also some younger people who are at risk if they have genetic or inherited disorders such as Marfan syndrome or Ehlers-Danlos syndrome.
Okay.
But typically it's seen in people in their 50s, 60s, or 70s.
So how would you know? What are the symptoms?
In the acute or sudden urgent setting, the typical symptom is pain, usually chest pain, mid to upper back pain, sometimes abdominal pain that is sudden, very severe. Classically, it can be described as tearing or stabbing.
With that kind of pain, should you rush to the hospital immediately? I mean, I would think most people would. I would think some people would think maybe I'm having a heart attack.
Yes. It is often, you know, sounds like a heart attack, feels like a heart attack. People often seek treatment right away. Sometimes these occur and they aren't, you know, urgent right away. They don't lead to lack of blood flow. So people go on with their normal lives, and they're found later on an incidental CAT scan or MRI looking at something else.
So quickly, what are the treatment options?
The main goal is to get your blood pressure under control, and that's to keep the dissection from getting worse and to keep your all your organs getting blood flow.
All right, sounds good. All right, thank you so much for
You're
coming by
welcome.
today. We
Yep.
appreciate it.